Hi again. So now it's my turn. For those who don't know me, I'm a TCM doctor and I'm specialized in preventive medicine and integrative medicine. As Marian said, thumbs up. So I studied both medicines and I practice, as I told you, preventive medicine. I work with elderly people in the nursing home with a nonprofit, and I advocate that our mission is to teach, assist, and help everyone, and also do research, collect data. If we don't do that, as Marian told us in the morning, we won't have integrative medicine. So that's my presentation. Bye-bye. I'm joking. I'm joking. We are really, really late, but I will try. I will try. So it all started when I was much younger and, of course, much more pretty, I think. In September 2001, during not the pandemic, but the crash of the Twin Towers in the United States, I was doing my clinical internship in China. I was 20-something. You can look at me and see how old I am. And I was healthy, but I was in a burnout. I was working a lot, studying a lot. And when I arrived in China, in my only month to do vacation, I was studying and working and jet lagged. And of course, I'm a little angry person, I say so. And I was angrier at that time, not sleeping, and really angry with everything. And so, as an angry person, I went to a TCM doctor and I said, I need to sleep. I don't feel well. And you know, when you start studying medicine, you think every symptom, you're going to die from it. And then you start thinking, oh, every symptom isn't nothing, right? You switch from one bottom to the other, which is crazy, by the way. But I went to that TCM doctor and she just looked at my pulse, my tongue, you know, the TCM, all the interview, which often everyone said is super important, the interview, 95%, I think. Not only the interview, to look at our patient, to listen to our patient. I mean, to look in the eyes of the person. Not only what she's telling verbally, but what with her communication, you know, overall. And as a young person, angry person, not hungry, angry person, I felt that she was not listening. And she told me, no, you just need to sleep. And also, why won't you take Poriococcus, Fulling? And I was again angry. Poriococcus, why Poriococcus? It's a simple mushroom. Again, I was 20-something, even more stupid and ignorant than I am now. And I can tell you, I love Poriococcus. I love Fulling is the other name. And I still use it. I take it myself, like maybe 6 months every year. And also I prescribe it. Not only Poriococcus, which is used, but it's a longevity mushroom with a ton of research. I mean, if you can research really quickly in PubMed, it's like pages and pages of research on Fulling. And it's incredible. So I'm sorry. So it has anti-cancer, antiviral. It can be used even with cancer treatments, which is very rare. So it's safe to use during chemo, during radio, no side effects. In terms of energetic medicine, we say that we treat spleen, humidity, mucus, calms Chen, and also treats Qi and Tai-Yin. So why prevention, right? I was healthy, I was jet-lagged, but she already gave me Poriococcus. So what is prevention? And not only why, what is? So it comes from the late Latin preventione, advance, anticipation, advance, anticipation. That's not what we're doing nowadays in medicine, not at all, right? We are treating secondary and tertiary prevention, not primary. If we talk about primary prevention, what we are talking about is vaccines, right? Very little of health lifestyle, very little. And that's what I'm aiming to do with my students and in my conferences, especially because of the TCM part of it. So there's 3 levels of prevention, as I told you, and we are only mainly doing secondary and tertiary prevention. Okay, so we're not doing the primary, where a disease is prevented from occurring. So I was jet lagged, right? I was angry. I was in burnout, and the doctor did prevention medicine, right? Poriococcus. He didn't wait for the disease to appear. He didn't wait for the chronic disease to appear. We acted early. He didn't say, oh, you're 20 or something. I don't care, right? No, he listened. So the data in Portugal is really scary, but not only in Portugal, in the whole Europe, and of course in the whole world. So really briefly, 51% of the resident population aged 16 and over assess their health status as good or very good. This is the government saying, oh, we have such good data, right? No. That means that 49% of the resident population age 16 or older don't feel healthy. This is not a good data, right? It increased it a little bit. Remember, with the pandemic, every data were different between, 2, 3, 4, 20 years, I think, in health issues and also mental issues. So the life expectancy, this is another interesting data, because people think that life expectancy is the main thing that we should look for, right? How many years are we expected to live? Do you think that is important? Let's see. So at 65 in Portugal, men live only expectantly 18 years and women 22. This is a good data, right? Women are winning from men, right? Let's see. So the estimate of healthy life years, this is the main data, healthy life years. I don't care about living until I'm 100 or 120. If I'm in a nursing home and I cannot walk and I don't feel good, right? I don't want to live like that. No one wants. So women live longer, but look at the data. Men live 59 years without any disease, and women only 57, right? And I was telling Elsa that I feel that women, because of their education and the role in the society, we tend to absorb all the shock, all the worst things that happen. And that's why we are caregivers, we are wives, we are mothers, right? And we are learn to shut, don't cry, don't argue. And then we get sicker and sicker and sicker. So another graph from general anxiety in Portugal. Also very bad, okay? 34% of the population age 16 or over revealed symptoms of generalized anxiety. Remember, 2023, after the pandemic, and it's getting worse. I work with psychologists, and it's getting worse. So this is, again, another really big data on chronic illness. So Portugal is the third worst country in European Union in terms of amount of chronic disease. And Italy is the healthy one. And Spain is like in the 8th country, which is better. So congratulations, Spain. And in terms of that, we can, of course, this data doesn't address medical error that we all know that it's the first cause of that. But first cause of that, cerebral vascular diseases. And again, in the second place, malignant tumors as causes of death. And of course, this data about malignant tumors and the death in terms of organs, we see that the main organs like lungs and pancreas are the worst because, again, the screenings are not efficient. It's very difficult to diagnose, right? And there's no prevention, primary prevention. So we have to do preventive medicine, which is replaces the model based on disease treatment. We cannot do a model that is based on disease treatment. We have to address health maintenance and the consequence, quality of life. So in TCM, and I really like also the ancient, and I use it in every speech that I do, is maintaining order rather than correcting disorder is the fundamental principle of wisdom. That's not what we're doing in Europe with the war, right? We don't have military. And we're not talking about that now, but it's the same. So curing a disease after it has arisen is like digging a well when one is thirsty, or like forging weapons after a war has begun. We cannot do that. This is from Neijing, of course. So prevention is preventing also chronicity, is for following the seasons is life and peace. Following them is disease, not following them is disease and death. In spring and summer, the wise man preserves his young. In autumn and winter is in. Thus he follows his origin. That means, and I give the example of the summer. We are finishing summer and we are between seasons now. And I don't feel like people really had preserved their young. I don't feel that people are happy, right? I don't feel like that because the world is so, I'm sorry, messed up that we didn't address the aspect of summer, to be happy, to be with friends, to be with family, to eat well, right? That's preserving is young. And in the winter, it's the opposite. We should be at home, preserving our energy, right? Preserving our emotions, our not being so much as outside. So we have to follow the seasons. We have to follow the circadian rhythm. It's the same. We can use this phrase for so many things, right? We know that, you know, health practitioners that, like nurses, that work against the circadian rhythm, it's proven that they are more sick, right? So Sun Si Miao, the way to maintain good health is to do light physical exercise regularly without tiring yourself out by doing things you can't do. So when we do CrossFit, I love CrossFit, but I'm not 30 anymore, so I cannot exert myself, okay? And also, we as practitioners, we have to do what we are teaching. I cannot tell my fellow students or colleagues, hey, don't smoke, and then I'm going to smoke, right? So we have to do what we are saying here. That's the first step. So there's general principles of prevention, and of course, I'm going to provide this presentation if anyone asks. I don't have time to go over everything, but this is all from the old texts, okay? This is all prevention, and it's still, science is proving everything that this old text says. You know, like all types of excess, physical, sports, sexual, and intellectual activities are harmful to in. In is your body, right? Your muscles, your organs, your emotions are in. Okay, so if you exert yourself, you're going to be really ill. Okay, and everything is excess. And also, I like to address that in my almost 30 years of practice, I think the main goal is mental health. I can change everything. I can teach how to eat, how to exercise, you know. I can prescribe drugs. I can prescribe supplements. I can do everything. I can listen. I can hug. I do everything for my patient, but we don't live under a rock, and life happens. So this is the main thing, you know, to keep mental strength. So what I teach normally is get a good support, good family, good friends. Surround yourself with love, because life will happen, always. So this is just a drawing of the shoe points, and also the shoe points can be utilized in acupuncture treatment. And this drawing is very beautiful because this explains exactly the function of the shoe points, which are not often used correctly. So in prevention, I'm not going to explain all of this, but in prevention, we should select the points, of course, according to the season and according to the patient. And also not only to choose the points, but to choose how to prick them, right? So, and the time that the needle stays also. You know all of this, right? But it's good to remember. It's very good to remember because we forget. This is the fundamental base. We cannot prick deeply in summer and in spring. You cannot put the patient like 30, 40 minutes in the spring and in the summer, only in the winter and the autumn. And this makes all the difference. And also, like in fashion, less is more. I advocate that we should only use 10 points at the most. So it's 5 points if we do bilaterally, okay? And that's it. You know, like a good chef in the kitchen. When we choose the correct ingredients, it works, right? In medicine, it's the same. So it's the same that I told you. In spring, jing points, in summer, wrong points. And if you see, in spring, I like to do this example. In spring, it's the season that we should do meditation, that we should do a really deep house cleaning, right? And take all the things out, and then take everything that we don't want, it goes to the garbage, and then we put it, you know, in the correct space. We should do it with our body in the spring, right? So in the spring, we have jing points, which are the points for mental illness. They are the points of the restart system, right? They are reanimation points. So everything fits, right? Everything is correct. So in spring and summer, pick superficially. In autumn and winter, prick deeply. I'm sorry. This is another phrase from Sun Tzu Miao. So I didn't bring my book. I also have a book, by the way, about medicine history. So Sun Simiao, the doctor must first understand the cause of the disease, treat it first with food, and if there are no results, let the patient take medication. So there's so many doctors saying that food is the first medication, right? So select points according to the patient or terrain, as we say in European medicine. It's the same again. So a young patient, of course, will react more quickly. So if I have, and I see that in the nursing homes, if I have a patient who is 80 and it takes like 10 or 15 drugs, he won't respond as another patient which is 20 and doesn't take any drug, right? And I'm finishing, I hope. So a bad doctor is the one who cures, a good doctor is the one who prevents illness, and the one who finishes conference in time, which is not happening, I'm sorry, but 2 minutes. So this slide shows a patient of mine in nursing home. So he's 80 years old and has Parkinson's. So it's crazy, right? It takes antidepressants, 2 antihistaminics, drugs, of course, for Parkinson. It takes an antidepressant, it takes iron, because, of course, he's anemic because of the age and also because he has omeprazole. So this is our day today, practice. And the goal is this, that I'm doing in private practice. So I have 60-year-old female patient, no chronic illness, no medication, no complaints, comes to routine checkup twice a year to show tests and ask for lifestyle advice, takes diet and supplement prescription and undergoes acupuncture. So this is the goal, okay? Of course, or to summon, protect the mental and have goals. Always have goals. Protect the mental. So prevention is very important and should result in maintaining good physical, mental, and social health, because we want to live longer, but we also want to live better. And we must return to our roots and be primary prevention agents. Primary prevention agents. So with great power comes great responsibility. And this doesn't come from the movie of Spider-Man. Okay? This is from 18th century and no one knows, but it still applies to so many things. So thank you so much. This is my contact. Thank you.